So, let's talk about something huge, something that affects billions of people but flies completely under the radar. We're talking about access to safe anesthesia. And yeah, it's about surgery, but it's so much more than that. We're talking about basic fairness, dignity, and honestly, life and death.
All right, to get our heads in the game, let's kick things off with a little pop quiz. Think about a high-income country like the United States. To become a specialist anesthesiologist, after high school, how many years of education and training are we really talking about? Just take a guess.
12 years. A full dozen. You've got your undergraduate degree, then 4 years of med school, and then you're hit with a grueling 4-year residency. I mean, that is an incredible commitment, right? And it's all designed to make sure patient safety is absolutely top-notch.
Okay, so that's the US. Now let's completely flip the script. Let's look at a low-income country, say Uganda, where the challenges are just on a whole other level. How long do you think that same training path takes over there? It's 9 years. Now don't get me wrong, 9 years is still a huge deal, but that 3-year gap, well, it's like the tip of the iceberg. It points to a way bigger story about a global divide in resources, in trained professionals. And this gap has literal life or death consequences.
So that little quiz really sets the stage. Here's what we're going to unpack. We've done our pop quiz. Next, we'll dive into the scale of this invisible crisis, then figure out why this imbalance exists. After that, we'll look at the efforts towards a solution, what's actually happening on the ground, and finally, why this is truly a challenge for us all.
All right, let's get right into it. The invisible global crisis. And when I say invisible, I mean it. The scale of this problem is, well, you're about to see. It's pretty staggering. Okay, get ready for this number. 5 billion people. That's not a typo. 5 billion. That's more than 70% of everyone on this planet who can't get safe, affordable surgery and anesthesia when they need it. It is one of the biggest and yet quietest crises in global health today. And let's be super clear, we're not talking about some small minority. In low and middle income countries, this is the reality for 9 out of 10 people. Think about that. Something that should be treatable, a broken bone, a complicated birth, can literally become a death sentence, all because this basic pillar of modern medicine is just not there. This chart really puts that workforce gap into perspective. It's stark. On one side, you have high-income countries with about 57 specialist providers for every 100,000 people. Now look at the low-income countries. It drops to less than 1, 0.7. That's an over 80-fold difference. It's just an unbelievable gap in trained people. And the result of that gap? Well, it's tragic, and it's predictable. In wealthy countries, dying from an anesthesia-related complication is incredibly rare. But in some low-income nations, the rate can be as high as 1 in 100. I mean, that's hundreds of times higher. And the most heartbreaking part? The vast majority of these deaths could have been prevented. So you have to ask, how in the world did things get this bad? This kind of imbalance doesn't just happen by accident. No. It's built on some really deep, systemic problems. Let's dig into the root causes. It really boils down to this kind of vicious cycle of 4 big issues that all feed each other. You've got critical workforce shortages and this brain drain effect. Then there's just not enough of the right equipment. You've also got a lack of policy and good data. And finally, there's this huge global divide in how we even approach pain relief. To really wrap your head around the workforce shortage, look at this. Ethiopia has a population of over 100 million people, and they have only 35 specialist anesthesiologists. 35. For the whole country. A single big hospital in the US could easily have more than that. And this is made worse by the brain drain problem, where trained professionals leave for better opportunities, making the crisis at home even deeper. And when we talk about infrastructure, we're not talking about missing out on fancy high-tech surgical robots. We're talking about the absolute bare essentials. In some places, over 70% of operating rooms don't even have a pulse oximeter, that little clip they put on your finger. It is basic, critical safety equipment. Not having one is like trying to fly a plane without knowing your altitude. It's that fundamental. And then you have what's called the global pain divide. And this is just wild. Look at this chart. A tiny group of just 6 wealthy countries consumes 80% of the world's opioids for pain management. That leaves the entire rest of the planet to make do with the remaining 20%. It's created this situation where billions of people suffer from severe, treatable pain, all because of fears and regulations sometimes called opiophobia. Okay, so things look pretty grim, but it's not all bad news. The global health community is finally starting to wake up to this. There's a real movement building to pull surgery and anesthesia out of the shadows and make them the priority they should have always been.
If you look at the last couple of decades, you can see this slow, steady progress. It started back in 2004 with the WHO kicking things off. Then in 2008, they launched the Safe Surgery Saves Lives checklist, a simple tool that had a huge impact. But the real game changer was 2015. That's when the Lancet Commission published its massive Global Surgery 2030 report, and the World Health Assembly passed a resolution that basically said, "Okay, world, this is now a global priority." That was a huge step forward.
And this progress is being pushed forward by an amazing coalition of groups. You have the big players like the World Health Organization setting policy, and groups like the World Federation of Societies of Anesthesiologists doing vital training. And then you have these incredible NGOs like Lifebox, which is laser-focused on getting things like pulse oximeters into the hands of people who need them most.
So that's the big picture. But what does this actually look like on the ground, in a small hospital somewhere with limited resources? The key here is that it's not about just shipping over a bunch of fancy equipment. It's about being smart, sustainable, and realistic.
The strategies that actually work are the ones designed for the real world. So, number 1, task sharing. You train and empower nurses and other providers to handle some anesthesia duties safely. 2, you use the right tech for the job, things that can work without a steady power supply. 3, you've got to fix local supply chains, so the essential medicines are actually there. And 4, you advocate for policy change so people can get the pain medicine they desperately need.
So when you put all of this together, the policy changes, the new tech, the different groups working on this, it all leads to a much bigger, more fundamental question about what we really value in global health.
See, for a long, long time, this was seen as just a technical medical problem. The solution? Just send more doctors and more equipment. But that's not enough. To really fix this, we have to reframe it. This isn't just a medical issue, it's a human rights issue. And that means the focus has to shift from charity to equity, from temporary donations to building strong, lasting health systems for everybody.
And if you're wondering just how high the stakes are, listen to this. We've rightly poured billions into fighting HIV, tuberculosis, and malaria. But the lack of access to basic surgical and anesthesia care kills 4 times more people every year than all 3 of those diseases combined. 4 times. It's time our priorities reflected that reality.
And that brings us to the final, challenging question. After all of this, it really boils down to one thing. Is safe anesthesia a privilege or a basic right? Should your ability to survive something as common as having a baby or fixing a broken leg depend entirely on where you happen to be born? The way we answer that is going to define the future of global health.